What's good, everybody? Welcome back to my channel. My name is Nguyen, and today we are going to talk about day shift nursing versus night shift nursing. So if you guys have been keeping up with my uploads this week, you know that this week is actually Nurses Week. So in honor of this year's Nursing Week and in honor of the fact that this is my first Nurses Week, I wanted to upload some nursing content for you guys, and this is just 1 out of 3. So this is actually my third day. We have one more upload for tomorrow. But like I said, today we're going to discuss day shift versus night shift. For those of you that are new to my channel, hello, welcome. I am a new graduate nurse. I currently work in a neuro ICU, and I'm actually 1 month out of orientation. So recently, for the past 3 months or so, I've been going through a ICU nursing fellowship, and for about 70% of the time I was actually on a day shift schedule, following a day shift preceptor for about 7 to 8 weeks, and then I was on a night shift and following a night shift preceptor for about a little less than a month, 3 or so weeks. I was hired for night shift, but the way that they kind of conducted the fellowship was that they wanted me to have more experience on days, or to see the way that days work before I switch over to nights. So that way I can kind of see the best of both worlds, and that way I can kind of know, what's the difference between day shift and night shift and our roles. And so today I'll be sharing with you guys what I think the pros and cons are to both. So without further ado, we'll just get right into it. The biggest pro to day shift is definitely that you are on a normal circadian rhythm. You are sleeping when the rest of the world is sleeping, and you're awake when the rest of the world is pretty much awake. And so it makes it very, very easy to work your days and have days off in between. So you could work every other day if you wanted to. So that is definitely one of the most attractive things about day shift nursing. Another thing that I would consider a pro about day shift nursing is that when you are on your off days, you are more likely to be a lot more productive and efficient with your time, because you're going to be so used to waking up at the crack of dawn and kind of having like a busy day, and then you go to bed at a certain time. It's kind of hard to sleep in if you're used to waking up that early. So even though you sleep in, you still have a good chunk of your day, and you have the advantage of taking care of things earlier. Doctor's appointments, self-care appointments, any obligations you may have. It's very easy to navigate because you're already on a day shift schedule. Another pro to day shift is that majority of staff is around, so you have unlimited resources, unlimited help for the most part. Even if there's like shortages in aides or something like that, regardless, you still have a lot of people around. You at least have like doctors and management around to help assist you in any way that they can. So definitely when there's like emergencies or anything like that, you definitely have enough support to kind of come to the rescue. And also, since most intensivists or doctors work during the day shift nurses typically have a better relationship with the doctors because they come into contact with them the most, because doctors usually round during days. So day shift nurses definitely have an advantage when it comes to that physician to nurse relationship. And lastly, a pro for day shift nursing is that they have better access to better food. So typically during the days when the cafeteria is open, and even if you wanted to order out, you have a lot more options during the day than you would at night. So overall, you have better selections and you have better access to better food. Now, this may not be a con to you early birds, but as someone who is a night owl, this is a major con. It's just the fact that you are literally waking up at the crack of dawn. Like, the sun isn't even up sometimes, but you have to be up. And you have to deal with traffic and parking, because the thing with day shift, like I said, most of the staff is there during the day, so you have limited parking options unless you beat the crowd. The fact that you have to critically think that early, that was a huge obstacle for me, because at 7 a.m. I was just not moving and grooving the way I do at night. So if you are an early bird and you just process and think and do all those things really well in the morning, this may not be a con to you. Maybe the traffic and parking part, could be a con. Since you have all this staff around, you have a lot more interruptions. Like I said already, doctors usually round during the day, so you have to interrupt your patient care to be able to be there for those rounds. They always say that day shift is busier than night, which I just think is a different type of busy. Not to just discredit night shift, but day shift is definitely a lot more busy as far as like tasks and being there for the rounds. When doctors round, they typically put in like new orders. So I feel like day shift nurses, especially with my experience, was like, it was very task oriented. So it kind of took away from the bedside a little bit, because you have to keep up with all these things, like if your patient's going for procedure, if they're going for any tests, like a lot of those things are during the day. And if they are at night, it's usually emergent, or it might not even be an option because some parts of hospitals close at night. So during the day is when the patient basically gets like maximum intervention. You might not be able to spend that extra time to talk to your patient for very long because you need to do things for them. You're just interrupted so many times, whether it's with your patients, whether it's with their families, whether it's with the doctors or any other discipline really, or just calls from lab or people at the information desk, whatever. And it doesn't help that most meds are kind of given during the day, and then plus the new orders, plus all these interruptions. It just makes it very hard, and it puts you kind of in that task-oriented kind of mindset because you're trying to hustle and bustle and do the best and do the most that you can during your shift and just get as much done as possible. The last con I would say for day shift is that you can really develop some huge FOMO, so fear of missing out, especially with the summer coming up and you are working during the day, and if your hospital has a lot of windows, you're just able to see the fact that it's a beautiful sunny day and it's warm and you are stuck at work. You can't go to lunch, you can't go to brunch, you know, you're just thinking of all the things you could have been doing during a beautiful day while you're at work. I don't really know any day shift nurses that get off, or I don't know any nurses at all really that get off and do much of anything when they get off besides go to bed. Even if you get off at 7 p.m. or 7:30 p.m., the chances of you actually like wanting to go out, slim. Or at least for me, it's very slim. I'm not going out after I get off. I need to sleep first. I need to shower. I need to do all these other things. This has to be the biggest pro to night shift that literally makes it worth it, is the shift differential. If you guys haven't heard about shift diff, most hospitals, if not all, at least pay shift diff for night shift nurses because it's considered the undesirable working hours. It's the graveyard shift. I feel like most jobs give you a little extra when you work night shift anyway, but definitely for nursing, hospitals are a 24-hour operation. They need people, or they need to make it attractive for people to come work when the rest of the world is asleep. So the biggest pro is that extra money. Sometimes it's like a set rate, like, oh, you get $4 or $5 extra per hour. Or I've even heard of hospitals kind of paying like 1.5 times your base pay per hour. I feel like mostly in my experience though, it's always the like set rate of like, you're gonna get this set amount of dollars extra per hour to work night shift. So that definitely adds up and definitely makes a huge difference, especially if you're looking at annual. I think annually night shift nurses make anywhere from $10,000 to like $20,000 more than a day shift nurse, which is really crazy. Really crazy. You do relatively the same job. Some people will argue that day shift does more than night shift, but you know, so that is up to you to debate. Another big pro for night shift is that there's not really that many people around. Usually it's a smaller crew on night shift. The only management you really have around is your charge nurse. So there's not a lot of micromanaging going on. No one's really breathing down your neck to make sure you're doing certain things at certain times or like auditing you too much. Also, since there's less people coming in to work on night shift, you have better parking options. Some hospitals, like my hospital, we actually get to park closer to the actual hospital versus day shift has to park in like some parking lot and shuttle over to the hospital. So sometimes that may be a factor that cuts into how much time you need to give yourself to go to work. That's a great benefit and less of a hassle if you get to work night shift and you get to, you know, park in special parking and be closer and be able to leave faster or get in easier. That may be a huge pro for someone who maybe procrastinates and is always right at the bell. Since you have less interruptions, you can actually spend more time with your patients, or you're able to be more at the bedside with them. If they wanted to talk to you for 20-30 minutes, it might not be such a big deal on a night shift if you don't have that much, you know, going on. Less meds to give typically on a night shift unless your patient is just like super sick or something. Doctors may or may not be on call. I know for my unit we have nurse practitioners who are around during night shift, which is extremely nice. So we don't really have to call doctors, we call our NPs who are already there. But I know for a lot of units, doctors are on call, nurse practitioners may be on call. So it kind of gives you more of an autonomy as a nurse to navigate situations and max out nursing interventions before you call them, because everyone knows you do not want to call them and get cussed out. Just kind of use those critical thinking skills a little bit more to make sure, you know, is this genuinely a reason to call? I would definitely say that to pro, because you have that autonomy to kind of explore a little bit more on night shift. Typically a night shift crew is very close knit. You have stronger ties with your coworkers because there's not that many of you and you don't have as many resources as you would on a day shift. So you guys kind of have to rely on each other because you are the resource. A lot of times night shift is like known for doing potlucks and ordering together all the time. Options are not only slim, but you kind of have that closer connection with them to want to order food together. Additionally, they like to say that for new nurses it's better to start out on night shift because it is kind of slower paced, so you have more opportunities to kind of look through your patient's chart, study them, figure out whatever you need to figure out, and you have the time to think about those things and then get up and go do what you need to do. Versus day shift, you hit the floor and you have to go because you have a bunch of stuff to get to before rounds, before these people call you, and all these other things. So definitely on night shift you have a little bit more downtime. Not all the time, but you're more likely to have downtime on a night shift than a day shift. So it gives you the opportunity to kind of explore, research some things, look into some things, dive into those doctor's notes and read through the ins and out of like what's going on with your patient. So that's a great benefit for new nurses, especially because we're still learning how to prioritize and manage our tasks, our meds, or really learn, you know, the hands-on things with whatever diagnoses we're treating. Lastly, a pro that could be debatable, but for the most part what I've heard anyways, is that night shift is actually great for people with families and even great for people with single household families, because you're able to get off and possibly take your children to school, and then while they're at school you get to sleep, or while they're at childcare you get to sleep and you wake up and you pick them up and you bring them home, help them with homework, and then you go to work. You're basically gone when they're sleeping and you're back when they wake up. And so that can be kind of debatable depending on the person, but what I've seen for the most part is that a lot of nurses, especially on the night shift crew, they say that it works out best for them and their family, because if you're working day shift, you're kind of gone from 7 a.m. to 7 p.m. When you get home, you know, you might have a few hours before your child goes to bed. If you don't have children, then this may not matter at all. Like, I don't have children, but I do think about this for when the time comes and I do have a family. I wanted to include that in for a night shift pro because there's just more cons than pros. So with that said, we're gonna go into the cons. The biggest con to night shift would definitely be the sleep schedule. So you are on the opposite circadian rhythm as the rest of the world. So overall it makes it very, very hard to balance your work and your personal life because you're sleeping during the day. So not only does your shift kind of cut into your off day, but you spend like most of your off day, your first off day at least, sleeping during the day. So you miss out on the sun. You get a lot of interrupted sleep because you're sleeping during the day when the rest of the world is doing stuff. So, you know, I've been woken up to maintenance trying to come, people mowing the lawn or doing yard work, cars, anything really. The sunlight, a lot of night shift nurses have to invest in blackout curtains, or they have to put in earplugs. For me, I wear my little eye mask sometimes if the sun is too bright. Just overall, the quality of sleep that you may be able to get can wax and wane. It can be, you know, good or bad depending on the day. It makes it very hard to get good quality sleep. And then on your off days, it's very hard not to like sleep the whole entire first day away, or if you worked multiple days in a row, sometimes it's harder for you to flip your body back into being up during the day and sleep at night like everybody else. And some people might even ride out on a night shift schedule even on their off days, and that can get pretty lonely because everybody else is asleep and you have no one else to talk to, but yet you're up all night because you've been used to being up all night. It also makes it very, very hard to kind of split up your work days because you don't want to work one day, off the next day, then work the next day, because it just like kind of throws off your body unless you're going to be on that night shift where you're just up all night and then you sleep all day to go to work. Like, it's just not very feasible. So you almost have to work your days back to back, otherwise you're gonna be just throwing your body in a loop and probably not physically feeling that great. So you're kind of forced to work your days back to back, which also makes you extremely tired when you get off on that first off day. You might sleep that whole day away. You might end up needing to take 2 days to recuperate, and then you really just feel like you have 2 off days versus the 4. Some nurses, get off and they might just get 3-4 hours of sleep, and they make themselves wake up by like noon, and then they try to just zombie it out the rest of the day, and then they sleep at night. It is a pretty stressful thing to put your body through, and it does affect your quality of your time off. You might not be as productive because you're just tired and you don't want to do anything during the day. So by the time that you want to do something, everything is closed. Overall, trying to flip back and forth is very hard on your body. It can definitely affect your physical and mental health. So I'm still trying to navigate that myself. A few days ago, I was up at 1 or 2 a.m. filming my story time that went up on Monday. So that's just like one example of how thrown for a loop you can be. You either kind of have to live this night shift life or just constantly be in a battle with your physical and mental health. You do miss out on the sun, you do miss out on things that are going on during the day. When you're asleep, it makes it very hard for you to meet your obligations. Like if you have appointments that are mostly during the day, it makes it very hard to kind of get yourself flipped to go to those things if you didn't have an extra day beforehand to kind of do that. So definitely it's very hard on your body, and it's just not natural for us. And I will say that that's probably the biggest thing that deters people away from night shift. It's either they don't like that work-life balance, or they just can't stay up that long. Some people can't stay up throughout the night. Definitely take that into consideration if you're thinking about night shift nursing. I kind of talked about this as a pro initially, but it can also be a con. So with less staff or less resources around, sometimes it can make it very scary and stressful when emergent situations do happen and you don't have all the resources that you typically would have on a day shift. Especially if it's like an emergent intubation. Sometimes on night shift on certain units, they might not be able to use certain paralytics or sedation with intubation, and that can pose, you know, a great risk as far as patient outcomes or just difficulty in intubating the patient. So that's just an example of some of the barriers to night shift sometimes, and with the resources that are available or the things that you can do. And so that's definitely something to think about, especially if you are going to be in a higher acuity level of care and taking care of these patients. You have to know what you can and can't do for them if something arises. There's also studies that have been shown that there's a lot of health risks associated with working night shift, not just in nursing, but overall just working night shift. Since it is unnatural for your body to be up at that time when it's dark, there are associated risks with like gaining weight. It just goes back to, you know, less options at night. The quality of food at night is just not as great as it is during the day, and there's just not as many options as well. So there are higher chances of gaining weight for sure. Studies have actually shown that when you work night shift and you sleep during the day, so when you're asleep when the sun is up, it actually lowers your metabolism, which in turn affects your weight and how fast you're able to burn off calories. So I guess no matter how hard you're working at night, it's just not burning as well as it is during the day. I think I read something where it was like, I don't remember percentage number, but a high percentage of night shift nurses actually gain like 15 to 20 pounds within their first year. And that is freaking crazy and scary. Some people snack to stay up. The potlucks and the ordering together, you know, you get tempted to like buy food even though you already have food. Now you are eating double the food. Aside from that, there's also risks of like developing diabetes, stroke, heart disease. But I think it also just boils down to, you know, what are you doing in your off time and how are you taking care of yourself? Just know that it's going to be a task to really be on top of your health if you're going to be working night shift. The last con for night shift that I can think of is sunning down. Oh my goodness. If you are a nurse, or if you're in healthcare, or if you're in nursing school, you've probably heard of this phrase called sunning down, which is when patients just go freaking berserk at night. They go crazy. They might have been fine and dandy during the day, and then the sun goes down and they start acting a fool. And most of the time it kind of stems from delirium, because if your patient is in the hospital room 24/7 and they've been in your hospital for greater than a few days, then, you know, they kind of get delirious. They don't really know what time it is. They don't know what day it is. They don't know that this is when they're supposed to sleep, because they might have been sleeping all day. So they just kind of go crazy at night. Depending on the severity, it can very much just be a little bit of confusion, or it could be they're constantly trying to get up and fight you. Sometimes it can happen for day shift. Sometimes patients have like the reverse effect, but for the most part, they call it sunning down for a reason. So it's obviously more prominent at night. So those are the cons for night shift. I know I said originally I didn't have as many pros for night shift versus cons, but I would say that there's just more important cons. Like the cons for night shift are kind of big. They're kind of like a big deal versus the pro, which the only big deal pro for night shift I would say is the fact that you make more money. There you have it, the pros and cons of day shift versus night shift. I hope that you guys took something away from this video. I hope it gave you some insight, whether you're a nurse currently working day shift or night shift right now, or if you're in nursing school trying to figure out which option is the best for you. Whatever it is, please be sure to leave a comment and let me know. Let me know if you work day shift or night shift and why, and what do you think is a benefit or a con for either. Give this video a thumbs up if you really enjoyed it. If you guys don't follow me on Instagram, please be sure to head over to Instagram to follow me, because I do post and interact the most on Instagram. As always, thank you so much for supporting me. I truly appreciate all you guys from the bottom of my heart. This is definitely another passion of mine, and I'm so excited to be pushing out this nursing content. I feel like my worlds are colliding, and it just makes me really happy to talk about things that I like to talk about. So for sure, thank you so much for watching. If you haven't subscribed already, please be sure to subscribe, and I hope to see you in my next video.